Hello guys, this is Brian here on a video about my horrible Obamacare experience and what my thoughts on Obamacare is. It really stemmed from 2 or 3 months ago that I received a letter from my employer, which was like almost 10 pages long and kind of flip-flopping and really they didn't want to really come out and say yes or no, we're going to have a health coverage in 2014. However, the letter did state if the premiums are going to be double or triple, they will eventually go and get rid of our health insurance, basically in one paragraph said. But really, nobody really knew. Well, I got another letter, I think on December the 1st, I got a letter, it was mailed to, no, I take that back, December the 2nd, which was a Monday. Got one in the mail from my employer, stating that from the 1st to the from the January to April, that premium will go up $10 to cover the I think they call it reinsurance tax. However, in April, they don't know it. However, it seems like the premium will be doubled or tripled. I pay at least $278 for an 80/20 plan with a $1,000 deductible and $3,000 it was a $2,000 or $3,000 stop loss, which is your co-insurance. Once those two things have been met, everything pays 100% except your co-pays. On my plan, co-pays do count towards your out-of-pocket expenses. And I said to myself, you know, I can't afford anything more than that. I really can't. That just almost going to eat up on my entire paycheck, and you know. So somebody suggested go on healthcare.gov and see what you can get. Well, I did that back in October and could not get it to work right. And finally, towards the end of November, I used a different email address and was able to go through the plans and actually look. And one plan, and they did tell me that I did qualify for this subsidy, which is the premium subsidy, so it makes the premium go lower to, for some plans, $83 and some $260. And I did qualify due to my income, qualify for the cost sharing reduction on the silver plan. So if you think that if you're, it should tell you if you qualify or not based on your income that you enter. So check out the silver plans because that will have your cost sharing reduction built into it. I said, okay, good. Well, I found a plan. Blue Cross is on there, so I have Blue Cross already. So I said, I might go ahead and keep Blue Cross. However, Aetna was offering some plans on there that looked a little bit better with lower co-pays, with a $175 deductible and I think a $1,000 co-insurance out-of-pocket maximum, but real dirt cheap co-pays. And let me pull it up here. I think $5 for a $5 co-pay for office visits, $15 co-pay for specialists, and things like that, and a $100 copay for emergency room and visit, and real dirt cheap copays. And I called them up with the telephone number listed on the little summary benefits because I had some questions about that. I asked well, first, can I speak to a licensed insurance agent? And they said sure, and they transferred me to the healthcare.gov telephone number. Well, I knew right before, I knew once they transferred me that it was not going to work out great. Because healthcare.gov people are not licensed insurance agents. They're just customer service people. They're not licensed agents. So I called Aetna back and waited online for 30 minutes before somebody picked up the phone again, and I told them what happened. She said, well, we don't have licensed insurance agents. I said, well, who can answer my questions? And she really said, well, we can answer generic, we answer basic questions. I said, well, I have specific questions about the plan that you offer on the exchange. I said, I want to speak to a licensed insurance agent. And she tried to answer the questions, and I asked her, on your plan, does co-pays count towards the out-of-pocket maximum? And I couldn't really get a clear answer out of her. So I hung up the phone and called them right back and got the same thing. And what it is I don't know who they hired, but they're hiring Filipino people. You could tell by the voice and all that. And it's just freaking aggravating about that. So if Aetna's watching this video, I give you customer service department at F Thank God I didn't go with y'all because bad service. Well, anyways, another reason why I didn't go with Aetna, my primary care physician is not in network with them. I once a year or twice a year I go to a GI doctor for my heart, for my reflex, whatever you call it, for the heartburn. There is not a GI doctor in a 20-mile radius except a couple of them in Dallas. I don't know why they're not contracted a whole bunch with the GI doctors, but here in Rockwall, in this area with Blue Cross, there's hundreds and hundreds of GI doctors with Blue Cross and Cigna. So that was another problem, and I also checked with with some other specialists. Eye specialists. He was in network with that. I think they call it ophthalmologist and things like that. Once a year, I go to a heart doctor about my blood. Well, I haven't gone since my gastric bypass, but I checked with him, make sure he was in network with Aetna. But Aetna just did not have any good network with doctors and specialists at all. And I checked with Cigna, and Cigna's plans looked okay, but except their copays. Now, I'm not going to pay $2,000 copay per day for hospitalization. That's just ridiculous. And just not a very good plan anyway. So I found a Blue Cross Blue Shield plan. So I'm going to stick with Blue Cross Blue Shield, except I'm going to get rid of my employer coverage and go with them. It's a zero deductible plan with a $500 out-of-pocket maximum. However, their copay is a little bit higher. I think a $30 copay for an office visit and $50 for a specialist. And, only bad thing I don't like about this plan is a $500 deductible for emergency room instead of $50 copay. And all the plans I looked at, Cigna, Aetna had $100, but Cigna had a $500, and I even saw one plan with a $1,000 copay for emergency room. So I called Blue Cross Blue Shield and asked them, well, why is that? Do you have any plans that has a low copay for emergency room? And they did let me speak with the licensed agent. They have to here in Texas. They transferred me to a licensed agent, and the licensed agent told me that the reason why the copay is so high on emergency room is they try and discourage people from using that instead of going to the doctor. I don't condone using emergency room for fibrous shit, like have a cold or anything like that. But when you're in pain, like for gout, back pain, you just can't stand it, and the doctor's office is closed or anything like that, that's when you, go to the emergency room. I suffer from migraines. I had to make sure my migraine doctor was in Aetna's network, and it wasn't. That's another special, I think they call themselves neurologists or something like that. I can't remember. But, when you're in such severe pain and you just can't stand it, you're going to have to go to the emergency room for them to give you some drugs, some IV drugs. And, at the doctor's office, in reality, they don't carry morphine or Demerol or anything like that to give you at the doctor's office anyway. Just like with my kidney stone. I was such in severe pain from it, I had to go to the emergency room for them to do a CAT scan. If I just went to the doctor's office for them to pussyfoot around, they had to schedule me to have a CAT scan. Hopefully, they close at 5 o'clock, and, I have to wait for the next business day to come around. Then I wait another day or two for them to find out if I have a stone or, it's just a slow process. In the emergency room, they could shoot you full of pain medicine and get your CAT scan done, and they could tell you what the course of action could be. If it's a severe case enough, they can admit you, like they did me. So I did qualify for the subsidy and the cost sharing reduction on that. So hopefully, I did get my because on the news they were saying that people were not sure if they're actually enrolled because the insurance companies were not getting the stuff from healthcare.gov back end of it to the insurance carrier. But I did get my welcome kit, so and I did pay my $83 premium to Blue Cross Blue Shield. So I'm really gonna be double covered on January just to make sure there's really no lapse of coverage. But I did tell my employer to go ahead and stop the group coverage on February the 2nd. You really don't want to go without any kind of coverage gap. Just you do want to have double coverage for at least a month or two, just to just to cover your butt, because you never know what's it can go wrong, especially with this Obamacare. So here's part two, what my thoughts on about this Obamacare. It's a big disaster. The president of the United States. I don't care. I'm not into politics at all. I don't care who you voted for or whatever. But he did lie to the American public, saying that you can keep your doctor and you can keep your health plan. Period. That is a big fat lie, and I can tell you. Let me explain why. Just like with my employer offers Cigna. Fixed benefit mini medical plan for part-time employees, which is, if that's all you can afford, good. It's a mini medical, which they put caps on everything. Like they only pay $2,500 for emergency room visit once a year, $1,000 for prescriptions only, and things like that, with a $500 deductible, and I think with a $30,000 cap per year for part-time employees. We also have full-time, part-time, and full-time employees. You get the full-blown medical plan. But usually those mini medical plans, usually for part-time employees, for companies or fast food industry or the retail industry, or small companies that can't afford a full-blown medical, because they just cover the basics. They're not catastrophic plans, basically. So if you had a heart attack on one of those mini medicals, you'd be up shit creek, basically. But that's what it is. Mini medical. And from a company's perspective, they don't want to spend a whole bunch of money on health care to begin with, and some companies will pay part of the premium, or maybe 20% of the premium, or 10%. Some companies make the employee pay for the whole entire premium, and things like that. So usually that's where the little mini medical plan, they call them mini medical plans, that's how they come in play. Well, now, since the Obamacare law took effect, which is the Affordable Care Act, those plans had to be gone because they consider them garbage. And I understand that, because if you work for a company and that's all they offer you, which is crappy medical plan, or that's all you can afford. So it's twofold on that. I mean, I can see on both hands. But if that's what you want, you're entitled to have it. Who is the government to tell you can't have that if that's what you want? I mean, so that's how he wrecked up the thing. He wrecked the insurance company industry. Also, another thing I'm really mad about Obamacare is since this all has to take effect on January the 1st, 2014, all these plans have to cover crap that nobody wants, like pediatric vision. Why do I have to pay for that if I don't even have a child? Or, this is a big joke on Fox News, men paying for lactation, breastfeeding, and maternity. Why do I have to pay for that if I'm a male? Why is it mandatory on every single body's health insurance plan? That makes no sense, and run up the premiums. So that's basically, or pediatric dental. Some of the plans, if you don't, on healthcare.gov, it says PD on some of the plans. That means it's attached with pediatric dental, which is like higher premium. So watch out for that. And because I know some of the plans are exactly the same thing, but one listed PD, which is pediatric dental. So that's something you have to be careful about. The only two things I liked about Obamacare from the word get-go was the elimination of the pre-existing condition clause, and maybe the premium assistance program, which is, you get your premium lowered. But there was no real savings of $2,500 per family. I think that's a big fat lie. Because all these new plans have such a high, of course, like on my plan, well, no deductible, but $500 coinsurance, but you dig through the co-pays, that kind of cost you. I mean, who has $500 laying around their wallet for emergency room visit copay? I don't. So, and then if you don't qualify for those kind of plans, it's an astronomical amount of money that you have to pay if you don't qualify. So I think this was a bad law to be passed. I mean, if you just left these two provisions alone, just have those two, no pre-existing condition and then premium assistance. If that was just those two parts of the law, I think we would have been fine. But now every single health company is now, all the insurance companies are affected by this. Then the day I was in the hospital, the next day, because I watched it on the TV on November 14th, the President of the United States was on the TV saying, well, yeah, we kind of goofed, but now we're going to ask the insurance company to keep you on the plan longer and all this, blah, 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 blah. Well, of course, no insurance company's going to do that because they spent millions and billions and billions of dollars on lawyers trying to figure out this big disaster. Now, another thing that I can't wrap my mind about is now, since there's no pre-existing condition clause, now the insurance company has to accept everybody who comes to the door. Now, that's a bad business practice. Where are they going to get all this money to insure all these people? It just not makes sense. It's like opening a store, but but you can't charge full price for anything, so therefore you're going to lose profit. Now, believe it or not, businesses are in business to make money. They have to make money to pay the payroll, pay the investors, and pay their employees. And an insurance company, they have to pay the providers. So if they're going to accept all these people with pre-existing conditions, which could be lots of sick people, there's going to be tons of money going out the door and not a whole bunch of money going in. So how's that going to work? It just makes no sense. So what they could have done is last year and this year, believe it or not, they had the federal government had a pre-existing condition plan, which I will post a link below, but you can't enroll in it because it's now discontinued because we're approaching the end of the year. Which, if you were denied by the insurance company for a pre-existing condition, you could have went on to this plan. So they could have done that. They could have stuck with that. But I think this is a big disaster. It's ruining people's lives. People's getting cancellation letters left and right. Don't know what to do. I'm hearing stories that people did go on healthcare.gov when it did work, did sign up for a plan, but the insurance carrier didn't get their information. I mean, what's going to happen then? So, in reality, I think this was a bad law that was not thought through thoroughly. Just like here in Texas. Texas did not participate in the health exchange, so therefore we had to go to healthcare.gov. Texas did not extend Medicaid, so if you're low income, you don't get to go on Medicaid. However, here in Texas, if you're on Medicaid, good luck getting a doctor to see you. I mean, just like Medicare, reimbursement rates are so low. I kind of thought maybe I could go on Blue Cross Blue Shield's HMO plan, which is a little bit dirt cheap. I think I saw a plan for 2 cents that I qualify for with no deductible and $500 out-of-pocket maximum, but no out-of-network. But I checked with all my providers I see, none of them were accepting HMO. So, you can't get screwed on that part, too. I mean, it's really, and United Healthcare is not participating in the exchange, so I don't know what, I went on their website and see what they're offering, and you can get a quote, but it's only through December 31st, so you can't get nothing for next year. So who knows if United Insurance is going to be around next year? I don't know. Maybe so. But this has been, it affects everybody actually. I mean, group and individual people. I mean, it's just because, grandfathering clauses and all this. And in reality, since the President of the United States did lie to the public, because he did lie, they counted it at least 32 times, that he did tell American people, if you like your plan, you can keep it. If you like your doctor, you can keep it, period. That's not the case if you lose your coverage. And, just like, what happens if, thank God Blue Cross is on the exchange. What happens if they wasn't? If I chose Aetna, half the people I see that are not on Aetna's PPO network. So, thankfully Blue Cross is participating. So, that, that's good news. And because they have to cover all these extra crap that nobody needs, like maternity coverage for men and all this, and pediatric dental and pediatric vision, the premiums won't be so damn high. That's another problem. Paying for stuff that you can't use. So, it's just a bad law that shouldn't been passed like this. And they knew about this a long time ago. And they knew healthcare.gov wasn't working. They had to know about it. But of course, it's going to be lied to the American public. So, in my thoughts, I think the President of the United States should be impeached for this. I think as sooner we get to the first of the year and midway through 2014, I think more people is going to become more angrier as we go more into this, because it's affecting people. When you affect people's insurance and and their money, people get pissed off. I'm kind of pissed off about it. I mean, why should I pay for all these services I don't need or anything like that, and then my premium doubles? That's not right. I mean, it's just crap. It's just nonsense. And then, the days that you have all these low copays, they're gone. Good old days, a $50 copay for emergency room, those are gone. No more $500 deductible plans with good co-insurance and good copays, they're gone. I mean, and the doctors hate this. I mean, it's just, excuse me, it's just horrible law. But if they just and then if you don't have any kind of insurance, they fine you, which, who cares about that? Of course, if you can't afford the fine, I mean, you kind of get screwed there. If you can't afford the insurance, it's a double screwed there. I mean, there's low-income people that can't afford the health insurance. Then they can't afford the fine that's imposed on them. So what do? You get screwed. What they should have done is just either open up Medicare or Medicaid, or do it like that pre-existing conditions plan, which I think I still have a link for that below. If they just open that up instead of forcing all these insurance companies to take on people, because let's face it, just like with my case, let me get my calculator out. Let's see here. If I pay $278 times 12, which, let's see here, comes out to $3,336 a year for premiums that I pay to my insurance company. Well, my insurance company lost money on that because my penicillin, my gallbladder, my kidney stone, they broke the bank on that. I mean, they spent more money on me than what they got from me. More money went out than coming in from me. So, if you're going to have lots of sick people on your rolls, how's this going to be sustained? It just does not make sense. But I do like that part where no, people can't be denied insurance because pre-existing conditions, because some of the insurance companies and will deny you for the most silliest shit there was. Like, I heard one person got denied for gout, or one person got denied for having a broken leg 10 years ago. And you know, they use that to trim down the sick people, basically. They want healthy people, not sick people. That's what the purpose of the insurance company. But they can't do that on group plans, on individuals. So I did like that part of the law. And maybe I do like the premium assistance reduction thing, whatever you call it. Please share your comments below, or private message me, see what your thoughts on this is. And if you're any of my Canadian subscribers, can you please do a video on how your healthcare works in your country? Here in the United States, we have private health insurance companies that we can go through. Now, if you're low income or have a disability, you can either use Medicaid, which is through the state, or Medicare, which is usually 65 and older, or if you have a disability, and certain disabilities, that's through the federal government. But the problem with those two things is most doctors don't accept those because the reimbursement rates are so low. But by law, hospitals have to accept those, especially Medicare. They have to accept those if they're a public hospital, and then they have emergency room. By law, they have to accept those deals. But private insurance here in the United States is weird. Each insurance company has its own PPO network, or HMO network, that you have to see their participating providers. So if you're like Pete, let me know how your healthcare works in Canada, because I never heard nothing about that. So let me know about that. Talk to y'all later.